It was an honor. At times it wasn't so much, but when I look back, it was an honor doing what needed to be done when it had to be done. Well, as a vet, and especially today being Veterans Day, and what all this is about, I think it was important that I do say it and I make my voice and my story known. And I served America as a United States Marine from 1967 to 1987, and from all the way from Southeast Asia to the Middle East. It was so strange after 72 years to be told that I have hepatitis C. I said, wow, I do. Because my first reaction would be towards the stereotypes that are associated with hepatitis C, the risk group, intravenous drug users, promiscuity. And I found out, wow, if it's not true for me, how many other people it's not true for, and how many other people have been kind of like stereotyped. And the doctor told me it could have been something that I contracted at birth. And then in the military, you get so many shots, and they're not using the right procedures for changing needles in the guns. And we won't even talk about blood splatter, because the indignity to the human body that's done in war is indescribable. So in many ways, I could have contracted it. When he did tell me I had it, so it was a little bit of shock, especially as it relates to my wife, because it's a new marriage. I just remarried in September 7th. And I didn't want to put her at risk. Excuse me. I'm going through treatment for this now because, as I said, Dr. El Badawi, if I can mention his name, was such a wonderful man. When I was going through all the changes with the VA and then with Social Security, he was there, and total health care was there. Between Dr. El Badawi and Herbert, the pharmacist, and the rest of the total health care people, I salute them.